Well, hello everybody, and welcome to the Herman Fire Activity Center. And we're glad you're joining us here today. This month, March of 2021, is Pharmacist Awareness Month. And we know that our pharmacists do a lot more for us than just give us our prescriptions. And what we want to do is always encourage you to work with your pharmacist as a team to help create the best plan for your health care. Now, pharmacists, they provide all kinds of services, especially some new ones. They do vaccinations, they have medical management, they are starting to prescribe for minor ailments and conditions. They're doing more for their patients than ever before. And so we want to be able to get an opportunity to ask our local pharmacists some questions that are often at the top of the list for a lot of our guests, as well as our clients here at the Herman Fire Activity Center. With me today is Nick St. Goodard. Now, he is a pharmacist at Hills Clinic Pharmacy, as well as Hills Drugstore downtown. So, welcome, Nick. Thanks for joining us. You're kind of got a half of me and most of him because we've got to keep our physical distancing. And I hope the masks aren't going to be too much of a problem. Nobody's here, but we don't know each other just as well. So, we're going to go with that way. Now, Nick, why don't you start off? Tell us what the role of the pharmacist is.
Pharmacist is the medication expert, basically. It's just our job to kind of make sure that everything with regards to the medication is being done safely and properly. So, just making sure that the right drug being dispensed for the right patient. We check for all sorts of, to make sure that it's safe with other medications that they're taking. And then it's our responsibility to make sure that the patient understands the medication, how to take it, what to expect, what side effects to monitor for, and what to do if certain side effects come up and stuff like that.
Okay. Now, somebody has brought up before, do you know more than a doctor?
Yeah, for certain things we do. Definitely specifics with medications, and of how they work in the body, like how, for example, how the body metabolizes certain drugs, and when there's interactions between certain medications or certain medications in foods or certain drinks, we'll understand more of that than, say, a doctor would.
Okay. So we're talking about our healthcare plan, and one of the things we want with our clients here at the Herman Fire Center is to take control of their healthcare plan, to make sure that they know what's going on, and they're not just being told what to do, and they just kind of blindly follow that. How do you, as a pharmacist, fit into working with our clients in their healthcare plan?
Well, we're really there to answer any questions that they have. So the door is kind of open for them to come to us or call us if they have any questions. If they're unclear anything, just to come to us and ask. And there are some things we do where we try to get them a little more involved, whether it's taking the time to sit down with them and, telling them that there are these different options and going through the pros and cons with them, and so they're a little more involved that way.
So you're definitely recommending that they take the time to talk to you, not just to pick up the drugs.
Yeah, I think that's the main thing. It's just, a pharmacist should be doing that regardless.
Okay. So that's an expectation they can have. That's what they're paying you for.
At the very least, yeah. If there's a new medication or a change in medication, the pharmacist really should be at least at the point of handout to discuss any changes that were made or anything that's new. It's kind of our responsibility to do that. It shouldn't really have to be up to the patient to go out of their way to get that information, but sometimes that's the case.
Okay, cool. Now we talked about things changing and you guys can start prescribing for minor ailments. So kind of give me a rough idea, or give our clients a rough idea. What does that mean? Can you prescribe drugs?
Certain things, and it depends on each individual pharmacist's certification. For example, some pharmacists are certified to prescribe for smoking cessation, so they've had the training, they've got the certification, so they can do it. Whereas some pharmacists might not have that certification, so it really depends on the pharmacist you're dealing with. Yeah.
So it comes back to, want to know a question? Ask.
Yep.
That's what they're there for. Okay. Refills though. I mean, can you okay refills?
Some things, if it's a medication that someone's been on for a long time and they're stable on that medication, there hasn't really been any changes, and say it's a situation where they run out of refills and they're running out of medication, then sometimes the pharmacist can extend the prescription to go for another month to buy some time, I guess, so to say. But if it's a new medication, yeah, I guess if you're not certified to prescribe in that area, then no, we can't really just prescribe new medications. In other provinces, some pharmacists will have a designation to initiate, say, blood pressure meds or other things like that, but again, that's in a different province, and it all depends on the certification. So currently in Manitoba, some pharmacists can have sort of an extended prescribing rights, but it's really limited here in Manitoba. So.
Okay. So let's ask a question that was sent in. Mrs. Reed wants to know, what's the difference between a brand name and a generic drug? And why is it so important for her to know this?
They are, so the generic medication is going to be the same. That's the chemical or medicine. The brand name is just one company's version of that drug. So another company can be making the same generic medication, but their brand of it will be slightly different in terms of the additives and other little things like that in the medication, but essentially the generic medication is still the same.
So what's the importance of knowing the difference between a brand name and a generic drug? Like sometimes people will want to know, well, I want to buy a Bayer aspirin, like I want that name, but at times you won't be able to provide that, or at least not to the Medicare or something. There is something tied in with Medicare about brand names and generic, right?
Yeah, cost is one important thing. Some, especially the brand name drugs, can be quite a bit more expensive, whereas the generics are cheaper and more cost effective.
So if the generic name is available and it's just the same as brand name, the Manitoba government's only going to pay for the generic name.
For the cheapest.
Cheapest thing. Well, that makes sense.
That being said, some people do prefer the brand name drug. Whether it is comes down to the certain additives in that brand name drug, whatever some people just prefer. They may find it more effective, or in terms of side effects, they might find the brand name to work better for them. So
we'll circle back. If you want to know or you feel differently, you need to talk to your pharmacist about your health care. Hey, we're going to keep harping on this because that's what's so important, that you take control of your health care alongside your pharmacist. All right. Why is it so important for my pharmacist to know if I'm using other drugs, including over-the-counter ones, business is it of yours?
Because, like I said, it can sometimes be dangerous to mix certain medications. For example, say certain blood pressure meds can be dangerous or not good to mix them with certain over-the-counter painkillers. So it's important for us to know exactly what they're taking over the counter and aside from prescriptions, so we can warn them and just educate them on how it could be dangerous and how to how if they are going to be combined, how to do it safely and what to monitor for.
Okay. Now, and with that, what about holistic medications? Somebody says that their daughter recommends that they take these holistic medications because it's going to help their blood pressure, or it's going to help their diabetes, or it's going to help something like that. How do you answer that? How do you are homeopathic medicines a good replacement for prescription medicines?
We just want to make sure that it's not causing them harm. So we will, again, screen whatever medication they're interested in taking against the actual prescription medications that they're on to make sure that there's no harmful interactions, anything like that. And usually if that's the case, then we just kind of present the information to the patient. We might look at the evidence for that drug and say that there isn't really much evidence that it's beneficial, but if we find that it's safe for that person to take that drug, then the ball's in their court.
Now, I heard somebody recently say that they were told to take 5,000 milligrams of vitamin B12 and it'll boost their energy. A possibility, I guess. We're not talking about anything dangerous here.
Vitamin B12, isn't really likely to cause toxicity, but it might just be, there's really no benefit to taking more than what's needed. So, again, we would just kind of maybe talk to the person about have they had blood work done, or take a look at their diet and see if they're really lacking B vitamins and stuff like that.
Okay. All right. Now, a very practical question. Personally, I do this all the time. What do I do if I miss a dose of my medication?
It really depends on the specific medication, but it really depends on which medication you're dealing with. Sometimes you can take it right away as soon as you remember, where other times you can just hold off until whenever your next dose would be, but it really depends on the specific medication.
So
again,
if a pharmacist and you have a plan, clients have a plan together, they'll know that.
Yeah,
that's part of the plan.
And that's another thing that the person should be well aware of if they're starting a new medication, is what to do if there's a misdose. And like I said, there's no one answer for everything. It kind of depends on the medication, so it's important to get that information in here.
Okay. How am I going to know though if my medication is working? What if I'm feeling better?
Again, that's another thing if you're starting out on the medication, to go through that with the pharmacist, because say some things like blood pressure meds, you're not really going to be able to feel it working. You're not really going to feel your blood pressure coming down or anything like that. So important to just be clear, understanding what you need to watch out for. So in that case, it would be monitoring your blood pressure and knowing when to expect it to come down and where it should be, and that sort of thing.
So if I feel it's not working or I'm not happy with what's going on, is it easier or should I be going to you first or make an appointment with my doctor?
There's also all sorts of different options. Again, that's kind of up to you, your pharmacist and the doctor, to come up with a plan. There should always be a follow-up plan. Whether it's if you have a follow-up with your doctor in a couple weeks, or if you want to follow up with the pharmacist in a week or two. It's always good to have a follow-up plan.
And you talked about in creating that plan, like you discuss, if you miss a dose, this is what you do. But there's also things like activities, things that they should or should not do. There's foods that they should or should not have. There's other medications that they should be avoiding, or over-the-counter products or something. That's all part of creating that plan with them that helps them stay healthy.
Yeah, sometimes there's a lot of information and it can be a little overwhelming. So, it's never a bad idea just to, as those things come up, you can, just call the number on your bottle and talk to the pharmacist there at the store as those things come up. But, there can be a lot of things to know right off the bat, and so that's why it's always good just to pick up the phone or drop by or.
I'm always curious about this, so this is one of my questions. Watch TV. We got these wonderful commercials about these drugs, and they look great, and they look exactly like what I want. Now, how does someone get those drugs off, those amazing drugs off the TV?
Yeah, it's usually those ones are, ones you're probably going to have to discuss with your doctor. So again, not a bad idea just to bring it up to a pharmacist. Pharmacist is always a good starting point, and then we can tell you exactly we can have that initial conversation to see if it would even be worthwhile going down that route or not, and then.
Now, I could be wrong, but we're talking about American television often. Those kind of things don't really come up on Canadian television or Canadian commercials. But when we're talking about the States and they have a whole different set of drugs that are not even available up here.
Yeah, and the advertising is a little different too. What they're allowed to advertise down in the States, not necessarily what you can advertise in Canada. You're right, the drugs can be different. Sometimes there's some overlap, or there will be a drug that's similar to it up here. But yeah, sometimes the drug's just not even available here. So
ask, talk. We can't push this enough. When is the best time to set out my refill? Like, I know my refill is coming. When's the best time to arrange for that? Like a day before, a week before?
Ideally, a little more than a day, in case we don't have any refills and we have to get refills from the doctor on some medications, say narcotic or controlled drugs. The refills will really have to respect intervals, so those can really only be refilled after a certain time. But it never hurts to call ahead and just to make sure that everyone's prepared.
So you're saying there are things that come into play. It's not as simple as here's my refill, fill it. Like, you might not have that drug in the store for whatever reason.
Yeah, might not have refills, might not have stock. All sorts of things can come up, so it's better to call ahead and then.
Yeah. Do you, like, for medication, do you give out anything with the medication to help people, like pamphlets, or does that kind of thing exist for extra information, or can I get extra information?
Yeah, anytime there's a new medication, we automatically will print off some patient information, and anytime someone requests that, we can certainly print off some information for them too. And then there's also sometimes things that will need to go along with the prescriptions. Say if it's liquid medication, they might need an oral syringe or a measuring spoon or other little things.
Right. So Lawrence wants to know, can I say no to a prescribed medication?
Certainly. Again, it's just a matter of making an informed decision. So I think it would be a good idea to, if your doctor's prescribing a medication that you're not fond of, to at least, have that discussion with the doctor or the pharmacist about the pros and cons. And once you're informed, then it's certainly your decision.
Cool. So let's go a little more practical. So I get a drug from you, my bottle's all nicely labeled with all these do not do's or do do's or whatever. Tell me how you understand it, or quickly, just in a brief statement, how you would explain take with food. What does that
mean? So some medications can irritate the stomach, and taking it with food just helps to minimize that. Because some medications can cause bleeding or ulcers, and so it's required to take it with a bit of food to minimize that risk. With other medications, the food's required for it to be effective, for it to get absorbed into your system. And then for opposite cases, some drugs need to be on an empty stomach for it to get into your system. So that's why that's important.
We're talking about food, liquid at all, like it has to be solid, or a glass of milk, Ensure, something along that lines. Would that be the same as food?
It again really depends. Some medications actually need to be spaced apart from milk,
okay,
stuff like that. So again, if you want to be clear, just check with the pharmacist. In general, it's just something in your stomach at the same time, but there are some circumstances where you need to avoid certain foods. So then just check with the pharmacist. Usually the pharmacist will point those things out.
Okay, so you're taking care of take on an empty stomach, do not take with dairy, you talked about that. What about may cause drowsiness?
Yeah, it's important because the person is, going to be taking the medication throughout the day and going to work or going to be driving, something like that. It's important for them to be aware that that medication could potentially make them drowsy, and so it might be a good idea for them to try it at home or somewhere first just to see how they react to it. And then on top of that, if they're on multiple medications that can cause drowsiness, it's important for them to know that adding another medication in there could, just make that effect even greater.
Yeah, what about take with plenty of water? Like, what's plenty?
And it depends on the medication. Some of them, because they irritate the stomach or the throat, just a big glass of water to wash it back. And then to go along with that, usually recommended not to lie down after taking the medication if any of it kind of works its way back into the esophagus. It can just be really irritating there. And then some medications are, it's required to drink lots of water for the duration. Say some antibiotics, it doesn't mean a big glass of water immediately after you take it. This is more drink lots of water for, say, the week that you're on it, and that just helps for your body to flush it out of its system.
Okay, cool. Helen has asked, how do I travel with my medications? Like, with all the changes and what you can or cannot bring on board or whatever, should I throw everything in the suitcase, or is there a way to travel with them that's helpful?
Ideally, if you can keep everything organized, plastic bag or have some other sort of container to keep everything organized, and then to have a list of all your medications as well would be really helpful. But I think it really depends on the airline and where you're traveling to, what specific things they might require.
The same question from her. If something happens to her medication while away, say, I don't know, maybe she's down in Florida, what does she do? Like, can she just go to a pharmacy down there to get her medication refilled? Do they contact you? Does she need to phone up here? How does, like, in case of emergency, how does she work that out?
Yeah, it could just be a matter of going to a clinic or something there. I mean, if it's really a dire situation and list, or if you're able to get a list of the medications you're needing and just explaining your situation there. One option, or sometimes I suppose the medication could be filled here and sent to whichever area. There's a few different options for how to deal.
Okay. What about bringing prescriptions into Canada that are filled in Mexico, for example?
Yeah. It really depends on what that country will have certain laws and regulations for what they allow in and what they don't. So it's important if you're traveling to, I'm not sure if you go through a travel advisor or, just important to be clear, which medications you can take in, what you can't, and what you can bring back and what you can't.
All right, let's talk about in the home. And a lot of people have different places that they stick their medication. Some literally stick their medication in like 1,000 different places. In our house, we have this cupboard that we just a top shelf that's all filled. What do you recommend for a good place to store a person's medication? Safest place.
Yeah. Again, not in the bathroom. That's one place where a lot of moisture and humidity can collect, and that can have an effect on.
But you're going against thousands of years of movies and television.
Yeah, it's truly not a good idea to keep your medication in the medicine cabinet in the bathroom. Ideally somewhere where it's going to be safe and out of reach of children and pets and stuff like that. Ideally somewhere where you can lock it up. Somewhere that's going to be cool, dry, those sorts of things. So
just because it has a child cap on it doesn't mean the dog isn't going to go through the side. What about taking the pills? What's the best way to take your swallow your pills or whatever? Just in general, like I take my nighttime pills. I just pop them and swallow. That's obviously not going to be a good idea for other people. Or maybe it's not a good idea for me.
And it depends on the specific medication again. Some medications can't be chewed or crushed. They have to be swallowed whole to work properly, so it's important to know that. If some people are chewing or crushing their medications because they have a tough time swallowing it, then sometimes it can be a little dangerous. If the medication is coated so that it slowly releases the medication over a period of time, crushing it or chewing it can release that whole dose all at once, which can be dangerous. And then some medications need that coating to get into your system to work, so chewing or crushing can render it ineffective. So again, it's important to talk to the pharmacist about that if you're having issues with swallowing or getting certain medications down. There can be other options. If you talk to your pharmacist, sometimes it could be a matter of switching to a different dose form of that medication, a liquid form or a compounded form. Again, just important to talk to the pharmacist about it.
And that's something that's becoming more and more available here in Portage, is the pharmacies are starting to be able to compound, which is taking their drug and putting it in a different form, essentially, right? So if somebody needed something changed because they can't swallow the pill, it's too big, a pharmacist should be able to discuss with them, okay, maybe we can compound this into a different form.
Yeah, exactly. Or if there's no commercial product that's available, usually it's special cases where it's a child or someone where the dosing is kind of particular, then the medication may need to be compounded. And only certain pharmacies are able to do that. There are quite a few new regulations that have come out recently, just with regard to
Okay. Before we get into the big thing that's on everybody wants to know, I want to ask a question about blister packs. People have heard the term. What are they, and how does it help somebody's healthcare plan?
So blister pack would be a card where we pre-package your medications. So say one card would have days of the week from top to bottom, and then the time of the day going across. So we would find out all of the medications that you take regularly. We'd find out what time of the day you take them, and then we would just go ahead and pre-package them. So then that just makes life a lot easier for the patient and can make things a lot safer as well. If you're taking more than one medication, multiple medications, it can be really easy sometimes to forget if you took it. Sometimes you can risk doubling up on your medication if you took it, but you forget that you took it and then you take it again, so it can be dangerous in that way. The blister packs, it's pretty easy for you to go back to see whether or not you took it that day. In general, it just makes life a lot easier for the patient, and yeah, there are a lot of other benefits to the blister pack as well.
Okay, cool. So I want to just get you to briefly describe what's happening right now with vaccinations. But before we do that, I just want to be very clear to everybody. You can talk and call your pharmacist, you can talk with somebody with regards to vaccines and that, but not a lot of information is out there with regards to who's giving them and why. What you need to do, and don't call the Herman Pryor because we don't know anything, but 1-844-626-8222. That's 1-844-626-8222. That is a provincial line for all vaccination clinics being run by the province of Manitoba. The different health, Southern Health, Northern Health, etc. You call that line and listen to their instructions. Now be patient. It's a government line. But follow through with that, and it'll tell you where things are, and then ask you a whole bunch of questions about whether you're eligible or not for those clinics. Here at the Herman Pryor, we are just a host. We have tables, chairs, and a floor for them to be on. We don't have any other information to help you with. Now, some pharmacies do have information. You have to kind of contact your pharmacy and find out, whether they're vaccinating people or not. But for now, what's kind of happening as of right now that you know of with regards to the vaccinations? Like, what can you say to kind of put people at ease?
So, over at the clinic pharmacy and Hill's Drugstore downtown, we haven't received any vaccine yet, but some pharmacies in town have, and so expecting probably sometime soon we'll get some in, but mainly people going online is one good starting point to go in there and check the eligibility criteria, and see sort of where you're at, and then it's got all sorts of different information for sites that are offering a vaccine, and you can even, if you're eligible, you can even book online. So online for one is a pretty good starting point.
So people are worried, they're hearing this vaccine's not safe, now it's not safe. It's kind of going back and forth, but basically, are all the vaccines kind of being used, and is there any major concerns other than extreme healthcare things?
At the time, I think there were a couple of concerns about the AstraZeneca, but those have since been sort of refuted, because they found that it is still indeed safe. Whatever concerns they had, they found are not compared to the event in the general population. It's not actually any higher than that, so there is risk to the AstraZeneca vaccine. And other than that, all of those vaccines have been rigorously tested. So, yeah, those vaccines would not be out there if they weren't deemed safe. So.
Now, with the vaccines, I mean, they're moving quickly. Like, I mean, right now, at points, you hear even down to 64 and things like that. So, people don't need to panic. They're getting those vaccines out, correct?
Yeah, and the eligibility criteria, day by day, the age keeps coming down. So, the information is changing very quickly and kind of tough to keep up with it, but it's coming down pretty quick.
So there are clinics happening in different places, and there are permanent clinics right now, Winnipeg, Brandon, Morden, and those criteria are dropping down, and they're changing day by day. So just keeping on top of that. Sure, reading the newspaper or reports is a good way to do it. Don't overwhelm the pharmacy with questions. A lot of places don't even have as much information as you might at the time, depending on what happens. You've got to remember, all these pharmacists work very hard all day. They don't have time to be on the news every minute, so somebody at home might know something before you.
Yeah. Well, I think that going online again will give you the most up-to-date information. So it's just a matter of going on there and checking the criteria to see where you're at. They even have a vaccine calendar or queue where you can type in your information and it shows you where you're at, and so going online.
So it sounds even better than the phone call. Go online and find that. You can type into Google Manitoba vaccinations, and it'll take you to the spot where you can get your information online. You can book online. You can follow where you are online, and that will help with everything.
Or if you've got a family member who has access to getting online, just go through them.
Yeah, absolutely. Yeah. Well, thank you. This is Nick St. Goodard. Once again, he's a pharmacist with Hill's Clinic Pharmacy and Hill's Drugstore downtown. We appreciate you being here and answering questions from all of us and being able to put our minds at ease and different things. Of course, everybody, we just want you to remember that the pharmacists on a day-by-day basis are doing more and more for you. And you need to take this next step and make sure that when it comes to your healthcare plan, you are making decisions with the pharmacist, with the doctor, with the public health nurses, and making sure that those decisions are being made as a group, as a team. Everybody wants to take care of you, but at the same time, you've got to ask the questions where it's necessary to ask the questions. But we want to thank you for joining us. We appreciate it very much.